Good morning. Thank you for joining the GE Healthcare Meet the Experts sessions. I'm thrilled to introduce our speaker, Dr. Elena Sinkovskaya. Dr. Sinkovskaya is a professor of OBGYN, director of ultrasound research and education, and program director of the Fetal Cardiology Fellowship at Macon and Joan Brock, Virginia Health Sciences at Old Dominion University. She will discuss VCI 2D and share the clinical utility in improving diagnostic accuracy and patient management. Dr. Sinkovskaya, thank you so much, and we look forward to hearing your presentation.
Good morning, everyone. Thank you very much, Kathy, for this kind introduction. It's my pleasure and privilege to present my experience of using my beloved technology, the VCI 2D, and I'm very excited to spend the next 30 minutes with you. So I would like to thank GE for the long-standing relationship and support of all my educational and research activities. And I have to disclose that I received the fees from GE for many events that I'm participating. So I think that the VCI 2D is a very unique technology, and I want everyone to be aware that only GE has that absolutely amazing tool that absolutely necessary for the clinical practice. And the main advantage of that technology is the fact that it provides the improved resolution, and that is based on the volume imaging advantages that is available as the 2D tool. So VCI 2D is implemented in the default user preset, and therefore is very, very easy to use. You just switch the buttons on your touch screen. So also, I would like to highlight that the idea of the contrast imaging is not very novice, so that the GE had the technology based exclusively on the 3D acquisition, used the VCI-A, and I think that you're all very familiar with that tool. So, but that is available on any ultrasound probe. At the same time, the VCI 2D is available on the matrix probe, EM6C, and I think that this is absolutely have to have probe, and I really lucky that I can use that every day in my clinical practice. So this is just to give you an example how crisp and how amazing image looks when you utilize the VCI 2D in comparison to VCI-A, and you can see that this is the example of the intracardiac masses. So I picked that because that shows you the differentiation of the grayscale tissues, so that the mass versus the myocardium, and here you can see that how clearly we can delineate the borders. So then we have the clinical situations, and in particular the challenging situations in OB imaging that I'm going to show you a lot of examples. The delineation of the structures, the mass, the organ borders, sometimes it's the critical thing for prenatal diagnosis, and using this tool and having that tool in your hands is really important. So here's just a few examples how you can visualize the fetal heart using this tool. So this is just a general preset, the fetal cardiac resolution on the 2D convex probe, and it looks pretty good. But once you switch to VCI 2D, that gives you that advantage of the thicker slice that the contribution of the volume imaging can provide. That gives you a completely different view of the heart, the depth, and the more details that you can recognize on the normal heart or in different pathologies. Also, don't forget that that can be combined with the tint maps, and my favorite tint map is copper. So if you see the image, the copper tint, most likely it came from me because this is like my signature, and I really encourage you to explore that because this is really friendly, at least for my eyes. I hope that you will find that too. But here you can see the variety of maps that can be utilized, and as you know, this is really helpful because in shades of color, our eye can distinguish more than in the shades of gray. So that it doesn't matter what tint map you're going to use, so make sure that in the difficult clinical situation, you utilize that opportunity. So Talking about the user interface of the VCI 2D, you can see that there are different sub-presets specifically designed for the different organs, that it's the tomographic mode, the standard, the resolution, the contrast, the inversion, the first trimester, the cardiac. So all of them are incorporated in the user interface, can be easily found on the touch panel, and the touch of just one button, you can have the VCI 2D adopted for the structures that you're looking at or for the gestational age that you're doing the examination at. So here's two images that presented here. So we are evaluating the fetal spine, and you can see that here we use the tomographic mode of VCI 2D, and the main focus is on the conus medullaris. So here we can clearly visualize the terminal portion of the baby's spine, and this is critical for the exclusion of the open neural tube defects, and so this is really critical for the screening evaluation. So this is the skeletal mode where we can really focus more on the alignment of the skeletal structures, and this is the vertebrae, and again that can be used as tint. So again, you can utilize that technique depending on the anatomical region that you're really interested at. So my passion is the first trimester imaging, and we are very proud that at EVMS, with the leadership of Dr. Abu Hamid, we established one of the first clinics for the first trimester detection of the anomalies, and he presented our experience 2 days ago at the lunch symposium that was phenomenal. So the contribution of VCI 2D is substantial to improve the contrast and to improve the successful visualization rate of different structures, in particular brain and the heart in the first trimester. And again, this is the transabdominal ultrasound at the fetus at 12 weeks gestation. So you can see that the quality can be achieved compatible to the transvaginal exam. So this is very, very helpful. This is just two examples how the imaging of the normal heart can be achieved, and we have the critical planes for the normal screening exam. Here is the 4-chamber view and the 3-vessel trachea view, but any of these planes that is a part of the detailed exam or the fetal echocardiogram can be utilized using the volume contrast imaging or VCI 2D, and you can see that those images are actually compatible with the anatomical specimen, so that it gives a lot of depth and resolution and really provides a lot of details. So here's an example of some pathologies, and we can clearly visualize that the VCI 2D can be used in just 2D mode or in the inversion mode. And here we can clearly visualize the septal-primum ASD, the foraminal valley, and this is the very easy to identify this cardiac anomaly, which is complete EV canal. At 35 weeks gestation, this is pretty challenging situation because we have a lot of shadowing, and even in this perfect position of the baby, it's not always easy to see, but that tool brings that extra contrast which is really needed in late gestation. The other very important area where we are struggling, this is the differential diagnosis of the pathologies in the abdomen, and this is where I see a lot of value of utilizing the VCI 2D because it helps to differentiate between the structures that have similar acoustic properties, so like kidney versus bowel, and sometimes it's not that easy to make the difference. So brain imaging, so this is the resolution mode of VCI 2D or tomographic mode. So here we can clearly visualize the brain parenchyma and the degree of the details of the gyration and the brain cortical development is pretty much amazing. And here on the sagittal plane, we can see all the regions of the corpus callosum and the cavum septum pellucidum and the regions of the posterior fossa. So that is really critical for the evaluation, and indeed it makes it very easy to see. So now I would like to show you some clinical applications of this tool, and first we are going to talk about the differential diagnosis. So here we have the example of the difficult situation because it's di-di twins, and usually on twin B it's more difficult to see, but if the twin A presents in the breech presentation, it may be very challenging. It's not that easy as on the singleton gestation. So this baby has the open neural tube, it has the neural tube defect consistent with the occipital encephalocele, and we can see the herniation of the brain parenchyma within the defect. But then let's compare that to this situation. So this patient was referred to us also with the suspicion of the occipital encephalocele, but you can see the use of the VCI to D that this has nothing to do with the defect in the skull, and even though this is solid mass, has no appearance of the herniated brain. So this is the occipital hemangioma that was confirmed after birth, and then the patient came. She was very concerned for the outcome of the pregnancy, considering different options for the pregnancy, including pregnancy termination, and we were able to provide the precise diagnosis that helped to save that pregnancy and have a really peace of mind for the patient and the excellent outcome. So here is an example of the differential diagnosis of the abdominal pathologies. Here we can see the classic presentation of the ovarian cyst, the daughter cyst noted within that bigger cyst. And here we have this mesenteric duplication cyst, that the cyst is actually attached to the loop of the bowel. So again, we can clearly visualize in the abdomen between the kidney, and this is really nice to see seen here between the bowel, and kind of get the origin of that cystic structure precisely. So renal pathologies also can be, the imaging can be enhanced using the VCI to D. Here we have a severe hydronephrosis and less severe on the other side. The cardiac imaging, the brilliant image that shows in details the anomalies such as the Epstein anomaly, the significant displacement of the septal leaflet of the tricuspid valve towards the apex, and see that the quality of the 2D image stays intact. Then you apply color Doppler, which is really important. So what challenges do we have in the B imaging? So for those who work on the south, and Virginia is not that south, but still considered south, the high BMI is a real problem, and about 36% of our patients stay obese or morbidly obese. So that we have clinics specifically dedicated to high BMIs, and sometimes the thinnest BMI you can see, the smallest is 40, so that it's 60, it's 70, it's 80, and the highest BMI that I scanned in my practice was 98. So that is challenging, and I will show you how this transducer can really help you to see through all this tissues and get to the baby, and this is really the life changer. Early gestation, we have the new guidelines that require to see in early gestation, and now we can bill for detailed exam, so the structures are small, difficult to differentiate. This is where the VCI 2D comes to play. So late gestation, a lot of shadowing, fetal crowding, and differential diagnosis of the structures, the similar acoustic properties. So all of this makes our work sometimes very challenging, very difficult, and I will show you some examples how the VCI 2D helps to overcome those. So obesity, right? So this is what we face on everyday practice. So if you utilize just regular convex probe, so that you see not that much. There is something in the uterus, right? So this is a clinical example. The patient came for detailed ultrasound. She was very anxious. She had the history of prior child born with a very major cardiac anomaly. Her BMI is 56, and you can see the quality of just applying the preset on the 2 to 9 probe, the cardiac penetration and adjustment of all the controls. So are you confident that you see the 4-chamber view on this patient? Probably not. So what can we do? We can apply the VCI 2D, the convex probe, and the matrix EM6C probe. So what's really important, then the footprint of this probe is bigger so that you can actually move the folds of the skin more effectively, so it has less stress on your shoulder. So, and then you kind of getting that window, the pressing and pushing things on the side by the probe. So that is really important, like physical maneuver as well. And you can see that your confidence level is definitely increasing here. And applying my favorite tint map, I think that it actually goes even higher up. So here we can see that we can reassure this patient that definitely the heart anomaly that the previous baby had, that was the double inlet single ventricle, so this little one doesn't. And then we would go to the outflow tracts. So we touched based on the challenges in early OB imaging. So this is the example how we can visualize the anatomy, and I want to highlight how well we can see the kidneys, the stomach, the cord insertion, and actually it's enough just to make one sweep, and this is what I did for this exam, and then you retrieve the individual images. So that is really a delight to use for the first trimester. So this is the example of the complex pathology in the abdomen. This is the duodenal atresia, but at the same time, that was a concern that we were not able to find another kidney, and the VCI-2D helps us to identify very clearly there is one kidney, there is another one, and the other one is in the pelvis. So that this is really critical because it improves the contrast, improves the delineation of the borders of the different structures, and makes our job easier. So another example of the renal pathologies. So neither renal fossa demonstrates the appearance of the kidney. So we can see the adrenal gland here maybe, but the tint helps us to visualize them very clearly. And there is no kidneys on either side, so that we were able to conclude here that this is a bilateral renal agenesis, and that happened relatively early. And the fetus still had some fluid around that could be very misleading and delay the diagnosis in this case. So another very striking example, so you can see that definitely there are two kidneys there, but they are very bright, so they kind of jump on your eye. So what you need to suspect here right away, so first you need to check the maternal kidneys, and this is the maternal kidneys. So that was the example of the autosomal dominant polycystic kidney disease, and they have that remarkable appearance that, again, there's enough resolution you can clearly see. So another example, that was the AMA patient. I want to attract your attention here. 6 pregnancy, no living children, so very desirable pregnancy. She came for the growth ultrasound at 36 weeks, 6 days. I mean, she was not having any care so far. So, and she came the possible suspected mesocardia and adrenal hemorrhage. So how confident are you that you are not missing the major fetal anomaly here? Well, maybe heart is a little bit displaced, but let me show you how easy to diagnose this pathology, the contrast that provided by the VCI-2D in this case. So you can see that indeed it's not as homogeneous as you can think at first. So this is doesn't look like the normal lung parenchyma, and indeed in the sagittal plane you can see the same. So this is the case of the congenital diaphragmatic hernia, that then only the bowel is eventrated. First of all, it's usually diagnosed only in the 3rd trimester, if ever during the pregnancy, and this is a challenge. And so here we were able to make the diagnosis, and that life of this child was saved, and that was really life-changing. So another example, so the patient came for the growth ultrasound, and this is the measurement that was done for estimation of the head circumference and BPD. And then that, reading this ultrasounds, I was thinking that something looks kind of unusual. I cannot see the anterior complex very well. So I decided to rescan that patient using VCI-2D. And you can see that this is the huge mass that can be delineated only by using the VCI-2D on that matrix probe. And you can see how vascular that structure is. Turned out to be glioblastoma. Unfortunately, this baby passed away on the 3rd day after birth, even though was sent to Johns Hopkins, to the best place to manage, and that was a very poor pregnancy outcome. So another challenge, the minor cardiac anomalies that may run in the family, such as the bicuspid aortic valve. The patient had the very tragic history in the family that some of the family members were affected by Schwann complex, were affected by the hypoplastic left heart syndrome, had like death in the early infancy, so that the patient was concerned if the baby has any features of the Schwann complex. So in here, I want to show you how easy you can diagnose the bicuspid aortic valve on this fetus using the VCI 2D, the copper tint. So this is really allows the appropriate counseling of the patient. So in here, I would like to show you some more examples. Here we have the patient who was referred for the major cardiac anomaly, and I just want to assure you that then you are focused on one anomaly, and this is just a regular assessment using the regular convex probe 2 to 9, and we diagnosed pretty obviously that this is a major cardiac anomaly consistent with the trilogy overflow. You can see the overriding vessel. Please don't stop here. Usually my junior coworkers tend to be very overwhelmed by the presence of the cardiac anomaly. They got very excited that they made the diagnosis. This is the pulmonary atresia. This is a critical form of tetralogy of Fallot, right? And then we found the other things. So don't stop, then you see the cardiac anomaly. So you need to look around. So we were able to see polyhydramnios. It's always not very good indicator because that should be concerning for genetics. Then we saw really, really small kidneys. See, they are echogenic, and again, this is an advantage of the VCI 2D that you can delineate that kidney very vividly, very clearly from the surrounding bowel. And then the winning situation is here, that we are looking at the brain, and VCI 2D allows you to make the diagnosis, which basically determines the prognosis for this baby. So we can see very clearly that the contour of the ventricle is irregular, and that study was done at 26 weeks. What we can see here, there is no insula. So that this is the abnormality of the cortical development. You need to be very careful, and this is the study done in the 30 weeks gestation. This is when you need to see at least some gyration here and there. So we can see the ventricular megaly here, the shape of the ventricle is not right. And this is where we started to suspect that this may be syndrome. So we looked later, and you can see that 23 weeks, that 28 weeks, nothing happens to the cortex. It doesn't show any evidence of the normal folding, and the baby showed some evidence of the growth restriction. So we performed the counseling. She declined an amniocentesis, but after birth, we were able to confirm the Miller-Decker syndrome that was suspected prenatally as a constellation of these findings, and that brain assessment was very consistent with lissencephaly. And the combination of lissencephaly with the major cardiac anomalies pretty much makes the diagnosis. And the last example, I think that this is a really exciting case because I think this is what you're going to see once in a lifetime. The patient was referred with a disproportionately big head on the outside ultrasound. This is the 36 weeks gestation. And what we can see here, again, the very, very deep sylvian fissures. So we applied the VCI 2D. We were able to see that very clearly. Then we were able to see a lot of periventricular cysts, and you can see the mid-sagittal plane using the VCI 2D. We can clearly visualize the posterior fossa structures, those cysts, the corpus callosum. So, and I can tell you that if you have never seen before something like that, you would be confused. But if you're a radiologist and doing a lot of imaging on the patients with the different genetic conditions, this is striking, and that brings you back like straight to the diagnosis, which is glutaric acidemia type 2. And this is really important to diagnose prenatally because this immediate therapy after birth and avoiding certain amino acids in the diet, so you can avoid any complications. And that was confirmed after birth, and we kind of saved life of this baby as well. So I would like to leave you the conclusions, and I hope like that presented here. I'm not going to repeat this. So I think that this is valuable, a very valuable tool. It's one of my favorite techniques. Not that I don't like others, but I think that this is the unique feature that GE has, and it should be emphasized that this is the game changer for the everyday practice. And if you ask me why I like GE equipment, I think that if I would just summarize that, the 4 words presented here, it's productivity, confidence, image quality, and intelligence. And I want you to remember that because this is what makes your everyday easier, and this is what makes you love your job. And I would like to thank GE for that long-standing relationship, and I hope that our future is bright, and we will have a lot of new technologies in the future that we will use for the benefit of our patients. Thank you very much for your attention.
Thank you.